There's one action you perform about 20,000 times a day, and you don't think about it for even a second. An action that keeps you alive, brings oxygen to your brain, and fuels every single cell in your body. Yet you only realize how essential it is when something goes wrong. I'm talking about the respiratory system, the invisible engine that lets you live, think, and move. And today, I'm going to explain it in a way so clear, you'll never forget it. The respiratory system has two major sections. One, upper airways, nose, pharynx, larynx. Two lower airways, trachea, bronchi, bronchioles, alveoli. Memory trick. UL equals upper filters, lower exchanges. The upper airways perform three essential functions. Filter the air, cilia and mucus trap particles. Warm the air, humidify the air. The larynx protects the entrance to the lower airways with the epiglottis and allows phonation. When these structures become inflamed, as in upper respiratory infections, voice, breathing, and patient comfort all change. The trachea divides into the main bronchi, bronchioles, and finally the alveoli, the key players in gas exchange. An important anatomical detail: each lung is divided into lobes. The right lung has 3, upper, middle, and lower, while the left lung has only 2, because it must make room for the heart. In the upper lobe of the left lung, we find the lingula. The lingula is not a true separate lobe, but a portion of the upper left lobe that functions similarly to the middle lobe of the right lung. It's a narrower, more angled area, which is why it is more prone to atelectasis, infections, or drainage issues. In some cases, it may show reduced volume, often due to previous infections, bronchiectasis, external compression, scarring. A reduced volume lingula ventilates poorly and is more prone to stasis and infections, so it should always be considered during respiratory assessment. The alveoli are small elastic sacs coated with surfactant, which prevents collapse and enables gas exchange. Memory trick: ALV equals air, liquid, vessels, to remember its connection with the pulmonary capillaries. Ventilation works through pressure changes. Inhalation, diaphragm contracts, negative pressure, air moves in. Exhalation, diaphragm relaxes, air moves out. Inside the alveoli, gas exchange occurs. O2 moves into the bloodstream. CO2 moves out. Memory trick: O2 goes where it's needed. CO2 goes where it can leave. Major signs that something isn't working: tachypnea, increased RR, respiratory distress. Use of accessory muscles, early warning sign. Wheezing, airway obstruction, crackles, fluid, pneumonia, edema, cyanosis, hypoxia. Low SpO2, less than 95%, impaired gas exchange. In clinical practice, these signs guide respiratory assessment. Understanding the respiratory system helps you distinguish mild dyspnea from acute distress, recognize abnormal respiratory patterns, small Cheney-Stokes, evaluate the effectiveness of oxygen therapy, interpret auscultation findings, wheezes, crackles, diminished breath sounds, monitor patients with asthma, COPD, and respiratory infections. It's one of the most essential skills for every nursing student. If you want simple diagrams, clear mental maps, and visual explanations for the entire respiratory system and its disorders, you'll find everything inside the Nursemate Pro digital guidebook. If this video helped you, hit like, subscribe, and turn on notifications. And remember, every breath your patient can take, thanks to your assessment, is because of you. You make the difference, future nurse hero.